Last week, a number of patients emailed me about their concern about this phenomenon known as the Ozempic face. And I went on to read about what this meant. And I live in Los Angeles, where most people appear to me to be on semaglutide. And it's the phenomena of people losing weight relatively rapidly, which makes their faces thin out. And then what happens, apparently, is that you look older because your face is more wrinkled and more baggy. And you might now have to go in to have further plastic surgery. And I only say that slightly sarcastically because of where I live. But what I want to talk about is, what do I think about this living here, where there's a great pressure to prescribe semaglutide off-label? And what do I think about it for my patients with diabetes? Historically, we haven't had much in terms of effective medication for treating obesity. And frankly, now we do. We now have agents that are effective, that have relatively few side effects, and that have become sort of part of what's out there. People are now wanting to use these agents, wanting to use semaglutide, and there's been this great need for these agents. The problem, however, is twofold. One, as we all know, it's basically caused a shortage of medication for treating our patients who actually happen to have type 2 diabetes and really need these medications to manage their disease. And then we have people who want these medications who can't pay for them. And because insurance does not cover obesity medications, that's made this problematic and actually quite frustrating for people who I think really would benefit from using these medications. So what I tell people, frankly, is that until I have enough of a supply for my patients with type 2 diabetes who really need these agents to control their blood sugars, I want to keep this class of drugs available to those. But I also hope that we're able to expand it more and more with improving insurance coverage. And that's a big if you ask me, both for people who have prediabetes as well as patients who are overweight and obese, because I think that it's really hard for people to lose weight. And I think that it's frustrating. And I think that for many people, being overweight and obese causes all sorts of other health issues, not just diabetes. And I really believe that these drugs are both safe and effective and should be more available. But I do think we need to be careful in terms of who we prescribe them to, at least at the moment. But hopefully we'll be able to expand their use. And I think that anything that can encourage our population to lose weight and maintain that weight loss is very important. And I think that we need to couple weight loss medications with lifestyle interventions. I think people can out-eat any medication, and therefore it's very important to encourage our patients to eat better, to exercise more, and then to do all of the other things they need to do to reduce their risks for other comorbidities. But I am actually incredibly happy to have these newer agents on the market. And I tell my patients, at least the ones who have diabetes, that they have to get over looking a little bit too thin for the benefits that we can see using these medications. Thank you.